But today we'll be talking about please help me share your screen, the slide, so that they can follow with the presentation.
Okay, let me take the notes so that I can share.
Okay. So just have give us some patience, like few minutes, so that you can share this slide with us.
Just a moment. Uh, Let me check the notes so that we can continue.
Okay. I think we can we all see the slide? Can we see the screen? Okay. Okay, so we'll continue. As I said earlier, I'll be talking on exercise and cancer, evidence-based physical activity across the cancer journey. And before now, we already know that cancer has been recorded as one of the most common causes of death worldwide, and it has the high rates of morbidity and mortality rates both in Nigeria, across Africa, and across the world. Before now, exercise has been totally discouraged from cancer patients. It's been believed that once they engage in exercise therapy, they tend to be more fatigued, they tend to be more tired, and they were totally discouraged from engaging in any form of physical activity. But due to the current researches and ongoing evidence-based practices, it's been demonstrated that exercise has been recorded safe and is most important during the cancer treatment. And also, depending on the type of cancer that you are treating, breast cancer, colorectal cancer, depending. So the type of cancer that you're treating also determine the kind of exercise that will be prescribed and your treatment pattern. Exercise plays a major role from cancer prevention to the rehabilitation to the active cancer treatment stage, then post cancer treatment stage. So whereby as a physiotherapist, you don't just matter during the cancer treatment stage, no, because there are stages. Cancer treatment has its stages. So you're playing a major role when the cancer has not been there. So in preventing cancer by engaging in physical activities, doing your exercises, healthy lifestyle, the physiotherapy plays a major role. Then down to when the patient has come down with cancer and it has been diagnosed that this patient has cancer. That's what we call the rehabilitation stage. To when the patient is now going ongoing treatment, the active treatment is ongoing, then exercise is also being introduced until when the patient is cancer free. Then you now know that okay, there is still post rehabilitation that will be going on. The next slide. So we are looking at the presentation outline. Next slide. Okay, so now the introduction, as I've said earlier, cancer still remains one of the leading causes, and researchers have shown that every year there are 20 million new cases of cancer, then 10 million deaths recorded annually. So you see the high rate of death that this cancer has been causing in the lives of people in the human race. So imagine if you are having 20 million new cases every year. And as I said earlier, exercise is not just recognized now as a supportive therapy, but is now recognized as an integral component of comprehensive cancer care. So now it has a major role to play and it should not be overlooked. And that is why this boot camp is coming on, and we are also encouraging physiotherapists to venture into cancer therapy, oncology, whereby we need more physiotherapists that will go through this route and people that are also passionate about oncology. This is actually the right time because every day there are new evolution, new researches, new evidence-based practices that are ongoing. Next slide. Now, we see that international organizations like the American College of Sports Medicine, American Society of Clinical Oncology, European Society for Medical Oncology, the National Comprehensive, and the World Cancer Research Fund, all of them also have recommended integrating individualized exercise into the routine of oncology care. So it's not just what an individual came up with or a set of people or group of persons. No, it has been recommended, recognized by world international organizations, and it has been established that exercise should be integrated while treating cancer patients. Okay, next slide. Now we'll be looking at the biological mechanisms now linking exercise and cancer. We have the first one here, modulation of chronic inflammation. We tend to notice that cancer patients, they tend to have persistent low-grade inflammation, which contributes to the tumor initiation, progression, angiogenesis, and metastasis. Now, when exercise is being introduced into when exercise is being introduced to the cancer patient, exercise has a way of reducing the circulatory inflammatory cytokines like the tumor necrosis factor alpha and the interleukin 6 and also the CYP reactive protein. So it has the exercise reduces this circulating inflammatory cytokines that increase the inflammatory process of tumors in the cancer patient and increase the anti-inflammatory mediators in the body. So when the anti-inflammatory mediators are being increased, it creates a very less favorable environment for tumor growth. So the rate and the speed by which the tumor grows is being reduced because of exercise has been introduced. The second one we have is improved immune surveillance, whereby the immune cells such as the neutrophils, the macrophages, the cytotoxic T lymphocytes are being released into the body, or their functions are being increased because of exercise. And when their functions are being increased, they they are released into the body, they tend to go and identify some foreign cells in the body and eliminate malignant cells, whereby reducing the cancer cells that are present in the body. So you see that when a patient engages in physical activities and exercises, our immune system gets better, their function, they tend to do better and improve the the function of the immune cells in the body. The next one is hormonal regulation. Some cancer, like breast cancer, they tend to do well and flourish well when there is high increase of certain hormones, such as the estrogen hormone. When it's high, especially in postmenopausal women, the breast cancer cells do better in that environment. But what does exercise do? Exercise helps to reduce the level of this estrogen in the body by reducing the adipose tissue, and also decrease the risk of hormone sensitive cancers such as the breast cancer or the endometrial cancer that I talked about. Exercise also improves the insulin sensitivity and reduces the circulating insulin and insulin-like growth factor in the body. So you see that when maybe someone is having some certain levels of hormones being increased in the body and the person engages in physical activities, the body has a way of reducing the level of these hormones in the body by reducing the adipose tissues and other tissues in the body, which helps to reduce the level of this hormone and regulate the amount of hormone that are being released in the body. So the next slide. Okay, body composition and metabolic health. Um, there are some risk factors that help to increase the rate of cancer. Some of the risk factors are obesity. Now we've seen that someone that is obese, obesity has been established as a risk factor for at least 13 different cancers. And when someone is obese, the best option is lifestyle adjustment, lifestyle modification. Because when the person adjusts his or her lifestyle and engages in physical activity, probably the person is living a sedentary lifestyle. That's why the person came down with obesity. But when physical activity is being introduced, the fat, adipose tissue, everything is being worked on. So exercise helps to maintain healthy body composition by reducing the visceral adiposity, preserving the lean muscle mass, and improving metabolic flexibility. Vascular function are also enhanced, whereby exercise improves the endothelial function, tissue oxidation, and tumor therapy while reducing tumor hypoxia, and which is a known contributor to treatment resistance. Next slide. So now we'll be looking at exercise across the cancer journey. Now, sorry, I'm coming. So the first stage is the cancer prevention, which I mentioned earlier, that exercise plays a role in preventing cancer. So let's just imagine a patient that is obese and has not yet been diagnosed with cancer. When exercise or the person meets a physiotherapist and engages in physical activities, definitely the chances of the person becoming a cancer patient is being reduced automatically. So you see that physiotherapy plays a role before in the preventive stage and also in the treatment stage. So this is what I talked about in the cancer treatment. Come here. Okay. As I said, approximately one third of cancer cases they attribute to lifestyle factors, including physical inactivity. So when we replace sedentary time with light intensity physical activities, we tend to reduce the cancer risk in a patient, and this helps to make the patient have a healthy lifestyle and live better. Also have to encourage lifestyle adjustment, modification, healthy living, healthy eating, and also be aware of what we consume, because most times we what we consume also matters, and the environment we find ourselves also matters. So all these things are to be in place during cancer prevention. Next slide. So now is the rehabilitation stage before cancer treatment. So yeah, it basically talks about when the patient has been diagnosed with cancer and the cancer treatment has been initiated. Okay, so there are some roles that exercise play. So here I listed the exercise-based rehabilitation, the aims, what we are supposed to do or what we are supposed to look at as physiotherapists during this stage is to improve the cardiorespiratory fitness, the increase the muscle strength, enhance nutritional status, reduce post-operative complications, shorten hospital stay, accelerate recovery after surgery, and improve psychological preparedness. Next slide. So now, exercise during active cancer treatment. So this stage is when the patient has started undergoing active treatment like the chemotherapy, the radiotherapy, immunotherapy, and every other therapies that the patient is recommended to go through. And this active stage is the most critical part. This is where the patient comes down with fatigue, neuropathy, different side effects from the treatment. So you tend to have pain, lymphedema, neuropathy, um, depression, psychological impairment, even sometimes the physical functions are being impaired, and the basic activities of daily living, the patient will not be able to undergo them successfully. Now, that is when the patient needs a physiotherapist. We tend to know that exercise, we will not just neglect these physical functions that have been impaired. No, we have to preserve these physical functions, and also quality of life has to be improved. We have to improve the patient's quality of life to make the patient live much more better. So during this period, these side effects or these symptoms should also be looked at. This is where the physiotherapist has also to work together with other professionals. Now, you will not neglect your functional assessment. You have to assess your patient functionally, assess your patient as a physiotherapist, and bring out your treatment plans and goals. It has to be individualized. It should not be generalized. You should not do the same thing you do with patient A with patient B. No. Then your goals, your treatment plans, everything should just be established, because sometimes their symptoms or their side effects, they vary, and the level of pain also vary. So you see that you have to work with your goals and your treatment plan for each patient. I also talked about collaboration. You, as a physiotherapist, have to work with the oncologist, you have to work with every health professional that are involved in treating this patient, because the whole aim and the whole goal is for this patient to recover and recover well. So during this active treatment period, that is when the patient come down with sleep disturbance, come down with pain, come down with anxiety, depression. Sometimes, most of them, they lose their balance. So we have to introduce gait training, we have to introduce balance training, active range of motion, reactive exercises, and the rest of them as much as possible, depending on the presentation of your patient. Okay, I hope we are all following. And during this period, the patient tends to have fatigue. So, and before now, it has been recommended for them to rest. But we have seen that even the rest is not solving anything. Like, the more they rest, the more they get fatigued, the more they get tired, and the more they stay in the hospital. So they now have prolonged hospital stay because of the fatigue. But exercise now has been proven to make them have a shorter stay in the hospital and make them more, like, have more strength, increase their muscle strength, increase their physical function, and they can do much better and perform their basic activities of daily living, so that they don't end up being a liability to their carers, to their family members, to their loved ones. Next slide. Exercise induces so these are the physical benefits of exercise during treatment. I've also talked about it: preservation of skeletal muscle mass and strength. And we tend to notice that some of these patients, they come down with atrophy because of the long stay. um they're not using their muscles, they are just lying down. So we need to work on their muscle mass, work on their strength, work on everything physically about them. There is also improvement in cardiorespiratory fitness because of the long stay in the hospital and the rest of them. Their respiratory fitness has been impaired. So we also have to do something about that. Maybe introducing incentive spirometer, giving them deep breathing exercises, and the rest of them. There is reduction of systematic inflammation. So when exercise is being introduced, as I explained earlier, the rate of inflammation in the body is being reduced because of the anti-inflammatory mediators are being increased, and there is also improved immune function. Next slide. So these are some of the side effects of cancer treatment. I just brought out the most common. And as I said before, the cancer related fatigue, especially when they go through the chemotherapy stage and radiotherapy stage, they come down with fatigue. And this fatigue is called cancer related fatigue, CRF. Is the most common, the most distressing symptom. Like, almost 80 to 90% of patients receiving this treatment, they come down with CRF. And this CRF is not like the normal fatigue that when you rest for a long period of time, you wake up, you feel better. No, it's persistent, it's disproportionate to activity levels, and it's not relieved by rest at all. So that means rest is like counter effect of it, or rest is more like aggravating the fatigue itself. So it has been proven that rest does not solve anything, and exercise has been demonstrated to be safe and more important during this treatment stage. So that is why we need to involve them exercises. And this fatigue now is something that once exercise has been introduced, they tend to gain strength, their muscles tend to pick up and be strengthening. Their cardiorespiratory system is also worked on. Every part of their body is worked on. It negatively impacts physical function, emotional well-being, cognition, social participation, and overall well-being. So every area is being affected with CRF. Next slide. So these are the mechanisms through which exercise elevates CRF. Talked about it: improved mitochondrial function, energy metabolism, reduced systematic inflammation, preservation of skeletal muscle mass, enhanced sleep quality, and improved mood and psychological resilience. So exercise is now recognized as the most effective part of treatment. It's not something that is optional now. No, it's a must. So we can't even neglect it. The next slide. So the next one I listed is the chemotherapy induced peripheral neuropathy, the CIPN. Here, because of the exposure cancer patients normally have with the therapies, chemotherapy, radiotherapy, immunotherapy, and all the even the endocrine therapy, they experience what to call CIPN, which is a side effect from the treatment. Some of them experience symptoms like numbness, tingling sensation, burning pain, muscle weakness, impaired proprioception, and balance deficit. All of them, sometimes they might have risk of fall and functional decline. So physiotherapists come in when you notice that they have balance deficits. You bring in your balance training, your gait training, and every other treatment pattern, treatment plan that you have for them, which can also help to improve some of these symptoms. And also will not neglect, like, improvement has also been reported when you engage them with postural stability, walking speed. So postures also can be worked on. So there are improvements in postural stability, walking speed, lower limb strength, and confidence in mobility. So we have to also treat some of these symptoms that they're having, like numbness, tingling. You can introduce your whatever treatment mechanism that you want to use to treat this patient. So that is why I talked about functional assessment. You need to assess your patient thoroughly, like go through each stage of assessment, each phase of assessment, so that you don't miss any part and you don't individualize, because you don't generalize, because some of them might just have only fatigue and might not come down with this neuropathy, while another person might come down with both fatigue and neuropathy. So all these are very, very necessary to pay attention to. The next slide. Another side effect is the lymphedema, whereby this lymphedema is more related to breast cancer. Is more common with people with breast cancer. You see that most times they have swelling in their limbs. So before now, the fear was that once exercise being introduced, it has a way of increasing the swellings and everything. But now the opposite is the case, because exercise now and maybe deep STM has a way of, especially when you go through effleurage, it has a way of even draining the swelling back to the lymph nodes and reducing the swelling and every other complications that come with it. So once you notice that your patient has lymphedema, you know what to do and the exercises to introduce to the patient to help to reduce this swelling. And also ankle pump can also go a long way. Ankle pump exercises, telling the patient to elevate his or her leg, especially while lying down. So these are some of the things that the physiotherapist can do to help lymphedema, and depending on the limb that is being swollen. The next slide. So we now talk about the psychological well-being, whereby the patient is maybe depressed or anxious or stressed or having sleep disturbances. So therapy helps, because it's been known that when a patient undergoes exercise, some of these hormones are being released, like the endorphins, the serotonin, the dopamine, the brain derived neurotrophic factor that helps to improve mood and cognitive function. So the person's mood tends to be improved. Patient tends to feel much more better, happier after undergoing exercises. Then we also encourage group participation, not just individualized participation, whereby maybe a group of persons or a cell will come together, they will do the exercise together. This also increase social participation. The patient tends to interact with other people, see the society, because they tend to isolate themselves, probably because of the, we like to call it the stigma they tend to have, because of you're a cancer patient and all those stuff. But when you encourage social or group participation, confidence is being increase, and they'll know that they are not just the only one passing through it. They tend to know that someone has passed through it and has recovered and is well much more better. They will be encouraged, their confidence, their self-esteem is enhanced, their quality of life is also enhanced, and every other part of their body. So the after the exercise, they also tend to sleep much better, especially for those that come down with sleep disturbances and depression and anxiety. And sometimes they also have the fear of recurrence. So you also involved this, yes, the psychologists are also involved, but physiotherapy also has a role to play. So the psychological well-being of patient also matters, and it should not be overlooked. Next slide. So these are just I just listed the role of physiotherapists, which include functional assessment, exercise prescription, fatigue management, balance and gait training. Next slide. Pain management, especially pain management, lymphedema rehabilitation, pulmonary rehabilitation, rehabilitation before surgery, then return to work rehabilitation. So after the surgery, after the whole therapy, there should be rehabilitation to work, return to work rehabilitation, whereby the patient can go back to his or her occupation or whatever he or she was doing before the cancer, go back to work as normal as possible. Next slide. So now these are what we should watch out before we prescribe exercises to patients. So we have to check their blood count, very important. The bone metastasis, cardiovascular risk, infection risk, surgical restriction, functional capacity, exercise intensity and type that should be modified according to the patient's needs. So all these should be what to have back of our mind when we want to prescribe exercise. So you make sure that the blood counts, the cardiovascular infection, everything is being considered. If the patient is hypertensive, if the patient is diabetic, and every other factor that has been involved before you now know the kind of intensity and how many times your treatment will go, your treatment section, will it be once a week, or 2 times a week, or 3 times a week? All of this matters, all these factors matters before you prescribe your exercise. Next slide. So this is the most oncology guidelines that are being recommended for exercises. So we see here for aerobic exercises, um, 150 to 300 minutes per week of moderate intensity activity, or 75 to 150 minutes per week of vigorous activity. Resistance training, at least 2 sections a week, and you should target on muscle group. So you see that these are some of the guidelines that we should also follow when we are prescribing our exercises. Next slide. So for flexibility exercises, 2 to 3 days per week, and also include stretching and range of motion exercise is very important. Both active range of motion and passive range of motion to prevent muscle stiffness and further deformities that will come from not moving your joints. Then there should be balanced training, especially when the patient is already having impaired balance, and if it's an older patient or has neuropathy or at risk of fall. So you should know when you should engage balance training and gait training. Next slide. So conclusion, the paradigm has shifted from recommending rest to encouraging movement. And with the current evidences, it supports that the principle that exercise is medicine throughout active cancer treatment, with physiotherapists playing a pivotal role in assessing, prescribing, supervising, and progressing exercise interventions as part of the treatment plan is very, very important, because now The saying exercise is medicine is not just a cliche, it's something that is a reality, something that is a fact, and it should be involved, it should be integrated at every stage of cancer treatment. And if exercise is being involved, that means physiotherapists are needed at every stage of this cancer treatment. Next slide. So these are references. Next slide. References also. Thank you for listening. So we've come to the end of this presentation. Thank you very much. With Wagura, I think we can take questions and inputs.